I'm Bobbi Denton and I live in British Columbia in Canada, and I've come down here to Dr. Kassman to have my hip replaced. I had it done 11 days ago. I'm moving around and I have new hope, and I'm very happy with the process so far.
We played golf together for quite a number of years. Our hobby is sailboat cruising and sailboat racing, which we've done for many years together, and that really wasn't feasible with the hip in the condition it was.
The hip pain, at least 3 years, and just has gradually, it's caused by osteoarthritis and in the joint, and it's just got gradually worse and worse. So you are quite limited to what you can do. You know, I couldn't play golf anymore, or I couldn't go cycling anymore. Just doing things with your grandchildren, just the normal part of life, that became more and more difficult. So we needed to move forward and achieve a result. Well, in Canada, I had a final meeting with a surgeon, and they gave me pretty well at least another year to wait. So a year is a long time if you're looking at, you're 70 years of age and you're looking maybe 10 good years physical. That's 10%. So it's sort of in desperation, because you think this is absolutely silly. This is a fixable thing. I mean, a hip replacement has fantastic outcomes.
Once the decision's made that it needs to be done, then waiting 8 months to a year, which was the estimate, is not a very good. Is not sensible if you can afford otherwise, and so that was our circumstance. We could afford to do this, so I'm totally on the same page with getting it done, and it's very happy with that decision, and the outcome seems to be very positive.
Dr. Kassman has on his site there, these are my expectations from my patients, for my patients, and this is, I expect that they would probably give up their walker within a week, and that they would be walking with a cane and they would give that up in 2 weeks, and that you would be doing these various things. And yes, I was quite skeptical about that. I mean, it's a fairly invasive surgery. It's not gentle. So there's no way I would have thought. I can't believe that it's only been 11 days since I had surgery, and I didn't disbelieve it, but if I take my own position, I thought, well, maybe this is a 40-year-old who's, nice and fit, and made this decision earlier on the journey. So I was skeptical.
And indeed, whether it was 1 week till you can walk without the walker, or 2 weeks or 3 weeks, it didn't make any difference to the decision. There was some mild skepticism there, but it wasn't a factor.
Oh, my hospital, I found the hospital was quick and easy. It was like I was only in there for 2 days, and the staff were terrific, and they were all there. Everybody's there for the one purpose, and that's to get you up and walking and moving very quickly. And you are doing that. A few hours after surgery, you're up and moving. That's right, and has been out walking in the parks. We went to the botanical gardens, and we rent a wheelchair and just took a wheelchair, and so I walked part of it, and I wheeled around wheeled part of it, yes. So I've been able to do lots of things I didn't think I would be able to. I didn't think I would feel well enough to go out into the botanical gardens. We went to the art museum, went around there, and so we've been doing quite a few things. Oh well, I feel I have a working hip that's going to work with me, and that it'll only get better and stronger, and I'll be able to go back to sailing and golfing and cycling and just living, you know, being with your grandkids. So people are going to may look at this video and say, yeah, they put her up to all those good lines.
But you're not the 40-year-old that was going to bounce back quickly.
No.
So
No, I'm the 70-year-old that bounced back quickly. So far.